If we think about how we felt 18 months ago, we're likely to remember feelings of uncertainty, times of intense debate, persistent questions about how we might fit into the new healthcare landscape. It was difficult to obtain concrete information about how healthcare reform would affect us, and yet everyone seemed to have an opinion. AAPA could have taken sides, jumped headlong into the debates, and allowed politics to drive our position. Again, that would have been the easiest path. Fortunately, regardless of our personal beliefs, we know that politics has never been a part of what we do. Partisanship has never helped a patient afford care, helped a business keep its employees healthy, or removed the burdens from the shoulders of millions of patients who every day go to work knowing they are one accident and one illness away from financial ruin. The most difficult roads are always those with the greatest rewards. Rather than get swept up in politics, AAPA decided to focus on our strengths, what we knew we could contribute. We focused on areas that would make PA practice strong and put us in a position that would allow us to provide the best care to our patients, regardless of what shape reform took. This was the only path that would truly allow us to adhere to the profession's mission of quality, cost-effective health care. The patient was our priority. Our CEO, Bill Lineweber, will discuss the details of our efforts later. I'll focus on what I observed as a longtime PA and AAPA member. The energy and enthusiasm PAs brought to our legislative efforts over the past year was inspirational, and I commend and thank everyone involved for their dedication. I have been a PA for nearly 30 years, and I've observed the profession as we've worked to find our place on the medical team. It is energizing to see the spirit of unity that has grown over the past year. We were able to cut a clear path through the weeds of the debate by sticking to our principles. Our presence was indeed felt, and we have brought a great deal of recognition to our profession. This wasn't because we hired the right lobbyist or pulled off a slick marketing campaign. Our profession was built largely through grassroots efforts. The early PAs didn't graduate to find the type of demand for PAs that we have today. They had to sell themselves and their passion for patient care. While we no longer need to work as hard to sell ourselves to employers, our passion for patient care remains. More than 8,000 of us took the time to share that passion with legislators through letters, phone calls, and personal visits. Would AAPA have achieved the same results without such a strong network of concerned and connected PAs? Not likely. And while nobody would think any less of us if we went about our daily routines, we recognized the need to get involved in discussions of healthcare reform if we were going to help improve the healthcare system for those we serve. As important as speaking out was our willingness to ask questions. Some of my fondest memories of the past year are the discussions, debates, and ideas that we shared during your constituent organization and chapter meetings and other gatherings around the country. We accomplished almost all of our legislative goals in regards to healthcare reform, but our work paid off in ways we hadn't foreseen. We went from wondering whether we'd be able to rise above the chaotic reform debate to being featured in major stories and major media outlets and in presidential speeches. Recently, several of us received a personal invitation to a presidential address on healthcare reform. A few of us were fortunate enough to meet President Obama and share the dais with him as he spoke. We worked through 18 months of tedious debate, yet we emerged with our original goals intact. That part The easy part is done. As healthcare professionals, we are now going to be entrusted to help craft the new healthcare system. We'll be responsible for explaining changes to patients while we ourselves adjust to change. It is an enormous responsibility, but one we are proud to accept. Our profession has never been one to take the path of least resistance. Think about what our profession would have been like if Dr. Eugene Stead, after founding the first PA program at Duke, had said, "That's good enough." Or even worse, what if he had dismissed his ideas about the profession as interesting but too complicated? The foundation was in place, but it would have remained bare without the work that followed, and may very well have been left to crumble. The innovative thinkers who developed the PA concept became advocates for the profession. The new ideas need leaders, not just to put the idea into practice, but also to ease the fear of change and help people adapt. We are now in a similar position. Our profession has a solid foundation. There is no longer a question of whether PAs will gain widespread acceptance. Our numbers are growing rapidly. In a few years, we'll exceed 100,000 PAs in clinical practice. So what do we do with a solid foundation? We build. We seize upon the opportunity that is before us. Those charged with implementing healthcare reform will need to draw on the talent and innovation possessed by America's healthcare workforce. We are trained to diagnose, to find the answers to difficult problems. The ability to discover the answers to complex problems will ultimately be the most important tool necessary to fix our country's healthcare system. While it may be hard to believe, this past year has been about more than just healthcare reform. One of the most important events of our profession was the Physician Assistant Research Summit. Those of us who have been in the profession since its early days knew there would come a time when we were no longer a young profession, and we would be required to spend much less time explaining who PAs are and what we do, and less energy fighting to be recognized. That time has arrived, and it has brought a new set of opportunities and some challenges. AAPA has made bold statements about the many ways PAs strengthen the healthcare system, and we are confident we can support those claims. However, in order to ensure that both we and our patients have full access to our brand of care, we're required to back up our words. The Research Summit was the first step in that process. Our profession thrives on teamwork, and we gathered some of the top minds from other health professions, research, and health policy. The challenge before us is how to best collect data that supports our claims about the positive impact the profession has on the health of patients across the country in every setting. We have begun to lay the groundwork for research to show not only how our profession benefits the healthcare system and patient care, but also gives us insight on to how we might best position ourselves as a profession.